Okay, well, I might make a start and welcome everyone to this historic landmark building we have here in Box Hill, the Town Hall, for this exciting first forum on disability inclusion in volunteering. Yes, indeed. Welcome. My name is Nicola Farray. I work at the Department of Health and Human Services as the Assistant Director of the Diversity and Community Capacity Area, and I'm thrilled to be here today looking after you as your MC. Before we begin, I would like to acknowledge the Wurundjeri people of the Kulin Nation, who are the traditional custodians of the land that we meet upon today that is now known as Whitehorse. I would like to pay my respect to elders past, present and emerging, and extend that respect to any Aboriginal people that we might have with us here today. I'd also like to make the personal observation that we can learn a lot from Aboriginal wisdom in the work we do with families, individuals and communities, and so we should draw on that whenever we can. I'm also proud to be working in a state that's working on treaty. I'd also like to acknowledge some people who are in the room and who've been working very hard to bring us to this moment today. I'd like to acknowledge the partnership between Eastern Volunteers, Rainbow Health Victoria and Volunteering Victoria, especially the staff who are running the Victoria Alive project for their hard work in organising today's forum. We are very excited to be running this forum today. It's the first of many, and we are thrilled to see so many of you here today, every seat full almost, which is fantastic. As many of you know, Victoria Alive is a project being delivered by Volunteering Victoria in partnership with Neighbourhood Houses Victoria and the Victorian State Government. The project aims to promote the increased inclusion of people living with disability as volunteers through raising community awareness and building organisational capacity. 1 in 5 people in Australia have lived experience with disability. People with disability experience many barriers to social and community participation. And volunteering is an important avenue for community participation for all citizens. For people living with a disability, volunteering holds numerous benefits, including increased social connections, pathways to employment, improved health outcomes, and better quality of life. The work you're doing is really, really important. This community forum is intended to engage volunteer-involving organisations in an active process to understand and address the issues impacting on disability-inclusive volunteer coordination and management at a local level. We can't emphasise the word active enough. You're going to be working hard today. In the Eastern region, there is an identified need for a call to action in securing organisational commitment to promoting inclusive volunteering in order to increase the number of available opportunities for people living with disability. And this need exists across the state. There is much more we can be doing, and we're very keen to see more and more of what is going on here today happening around the state. Today, we have a mixture of people representing organisations interested in providing and supporting volunteering opportunities for people with disabilities. We also have people with disabilities and their carers wishing to volunteer in their communities. I welcome you all today and look forward to the conversations we will have and the impact that we can all have when we walk out of the door today. Today gives us a really important opportunity to connect and learn from one another, so I encourage you to not only actively participate in the activities, but to also have conversations in the break and walk out of today with passion and a bit of excitement about what we can all achieve when we work together. So before we run through the program, I might just do a bit of housekeeping so that things run smoothly. Bathroom facilities and accessible toilets are located through those double doors. Turn right and just go down the corridor and you'll see them. In the event of an emergency, we've been asked to remain seated and wait instructions from event staff. I have been reassured that we are in safe hands. Event staff and volunteers are on hand today to help you with any queries you may have. They are wearing coloured lanyards. And if you require any assistance at your table, just raise your hand and someone will come and see you. I think you can see some of the staff at the back there with the lanyards, but everyone's pretty identifiable. Please alert staff or volunteers if you are having any kind of medical emergency or need access to first aid. You should have everything you need to participate today on your tables. We've given you pens, paper, water, but if there's anything that you run out of, just let us know. Coffee and tea is available throughout the morning at the back of the room. Hopefully some of you have helped yourselves already. Feel free to get up and grab yourself a cuppa if you wish to throughout the proceedings. Today we're also going to be referencing quite a number of publications and references all of which will be made available on the Victoria Alive website, and we'll provide those details to you via email with a link and everything after the forum. So just be mindful that you'll get access to all of those. And also just to reiterate that today's event is being video recorded and photographed for use in promotional materials. We have sought everybody's consent for that. Just a reminder, if you do not wish to be photographed or videoed, just collect a red sticker from the team at the front so you can pop it on your name badge, and that way the staff know. And also to let you know that we are evaluating today's proceedings. We want to run more of these, so we want to hear from you about how today went. There are what we're calling graffiti boards with stamps available for you to interact with in the morning tea and lunch breaks, so we encourage you to get involved in that process. There'll also be postcards for evaluation purposes available at the end of the forum, and instructions about those will be provided. And you'll also be emailed with a survey about a month after the forum asking for your input and feedback. So today is a pretty big day, and so I'm just going to quickly run through what you can expect. As you can see in your program on the table there, our first session is going to be a panel discussion where we hear from community members with lived experience of disability and volunteering. We will hear from 3 terrific speakers, Melanie Edge, Samantha Bewis and Callum Lydiard, each one with lived experience of disability. Mel, Sam and Callum will be properly introduced later, but I think we should be very grateful for them stepping up and telling us their stories today. We'll then have David Perry, Research and Policy Officer, and Judy Buckingham, the Victoria Alive Research Worker from Neighbourhood House Victoria, to present some findings from their research that they've been doing as part of the Victoria Alive project. After that, we'll be running some sessions at your tables. Each table has a scribe that will be recording the key elements of your discussion, and the team will be roving around providing support to your tables as needed. Then we're going to have a break for morning tea and give you a bit of a rest. During that time, we'll collate some of the feedback that we've received on the tables and then summarise those findings for you after we return. After morning tea, once we've heard back some of the things that you've been discussing, there'll be a World Cafe discussion about opportunities you've identified, issues, challenges, barriers, good ideas, and then we'll be wrapping up the day with a call to action. We'll close the day encouraging you to continue the conversation. So thank you very much for coming today. We're looking forward to proceedings, and I'll now hand over to Pam.